I'm excited about going out there and having our hospital be all about women's health care and just being about women. It's a very warm and cozy atmosphere that we have. The input that we nurses had as far as patients and families and the environment that we were going to be working in is we were allowed to have mock-up rooms that we could go and see what the decor was like, what the monitors were going to be like, where all the equipment was going to be, and we had input on where things went. We were asked, how would it work best for you, and what would be most comfortable for the dads and for the children visiting their moms, and where to put the TV, and where to put the bathroom. We had input on that the entire time. It's been one big team effort to make a great place to have babies and to have women's services. As far as changes made to the mock-up rooms when we walked in the door, the first time we walked in the door, yes, there were a lot of changes, because when you're doing something like this, when you're making a whole new environment to work in, you have the ability to say, this is what we have now and this didn't work so well, so let's try to better it. And so it was nice to walk into the mock-up room and be able to say, I don't like that there, I want it over there. Or that color maybe isn't going to be as warm and fuzzy as we'd like it to be. And so we were able to do that. And the people that were managing that and organizing that listened to us. And that was a huge, huge thing to nurses. I think that having a specific women's hospital is going to be a big benefit for women, for families. I think we need to learn to emphasize on women's health care. And by having a specific women's hospital, I think that will be a big pull for people, that's what we're thinking about. We're thinking about women's health care. I'm just excited to do it. I mean, I think it's going to be great. We have such a great environment here that the thought of going out and that's what we're going to be, is just all about women and their families. I think it's just going to be an awesome adventure.
As patients ask, as we get ready to transition to the new women's hospital, I just share the enthusiasm of what services are going to be offered to them in addition to what we currently have here. Everything's going to be in one location. We're excited to be able to have the physicians there so that if we have things that we need to converse with them, we'll have them on site. And there are going to be other services available that are just for women that I think will really benefit our community. I'm excited just to really raise the bar for women's health in this area. We have the opportunity to go out and really make a change, and it's not going to change the care that we provide being in a different facility, but I think we're going to be able to expand on the services and just have the highest, latest technology and research available for our patients. The mock-up rooms we've had here in the hospital, which are rooms that are going to look like what we have available out at the Women's Hospital, and we've been able to go in and make change from a nursing standpoint and from a patient standpoint as to where we need to move things to make it the most beneficial for nursing staff, to make it better for patients and their families, and I'm really excited to see that transition as we go out there. As far as in the rooms, just locations of computers for charting that we have to do when we have to draw labs on mom or baby, just locations of, simple things when we get up surgical patients to take a shower, what's going to make it easier getting them transitioned to the bathroom, making it easier to provide baby cares and teach those cares to the moms and dads and their families as that comes up, and rearranging all that to make it fit for all of us.
I'm excited to work at Methodist and be a part of this change to start the first women's hospital around here, to have a specialized hospital for meeting the needs of just women, whether they're pregnant or seeking GYN services. Our patients and even those out in the community are excited about the women's hospital. They're asking questions. It's something new. It's something just for them as women. It's an exciting change. They had mock-up rooms available for us as staff, and management and patients were welcome to go there, and we had input on the decorations, the floor, the wallpaper, where we wanted things placed in the room, what kind of tables we preferred, bedside tables, where we wanted the garbage cans located, all sorts of input on the rooms. And so we were able to at least give our say-so on what we would recommend and what we hear patients tell us that they would like to have in the rooms. I'm just looking forward to maintaining the excellent reputation that Methodist has, especially in birth services, and to be a part of this new team and new change.